JBN, we keep you informed. 3 killed, 1 injured in Kingston. The Denham Town Police are probing the deaths of 3 men and the injuring of a woman in 2 incidents yesterday, Friday, April 17. The police said about 2:30 a.m. lawmen were called to Torrington Park, Kingston 5, after residents heard explosions. On arrival at the scene, the police said they saw a house on fire. The Jamaica Fire Brigade was summoned and the fire was extinguished. The police said checks at the premises revealed the bodies of 30-year-old Romario Raymond and 20-year-old Clifton Grant, both of Torrington Park addresses. The bodies were subsequently removed to the morgue. Hours later, in a separate incident, 16-year-old Dave Terrell of Drummond Street, Kingston 14, was shot and killed, and a woman injured by an unknown assailant about 9:45 a.m. on Bond Street. Reports are that Terrell was standing on Bond Street when he was approached by a gunman who opened fire, hitting him. The woman, who was in the same vicinity, was shot and injured during the incident. Both were taken to hospital, where Terrell was pronounced dead and the woman admitted for treatment. Investigations continue. Turks and Caicos resident granted landing permission in Jamaica despite restrictions. A senior government official has sought to explain that a Turks and Caicos Islands patient was allowed to enter Jamaica on Thursday because he had an urgent medical emergency. However, the official says all the protocols were followed to obtain the requisite exemption from the current order restricting incoming passenger traffic to Jamaica. It was for a life-saving procedure, the official said. The patient, who has been treating cancer, is now at the University Hospital of the West Indies after completing the procedure and has since tested positive for COVID-19. As a consequence of the positive test, the head of surgery at the hospital has been quarantined. It could not be immediately ascertained how many other health workers are in quarantine. In a statement, the University Hospital only said all staff evaluation, assignment, and quarantine have been done according to the hospital's protocol. It also confirmed that on Thursday it received the patient for advanced critical care, a service it usually provides to people of territories that contribute to the hospital. The hospital also said on March 16 this year it had treated the patient for bleeding gastric cancer, and on March 26 he was released and sent back to the TCI. According to the hospital, the patient subsequently had another operation in the TCI. However, he required further surgical attention that was not available there, and so a request was made for him to come to Jamaica for the required medical attention. Based on the hospital's screening form, at no time was the patient considered to be a COVID-19 patient. But out of an abundance of caution, the hospital decided to test the patient, said a hospital spokesperson in the statement. Recently, a group of Jamaican ship workers aboard the Marilla Discovery 2 were not allowed a landing because of the restrictions on passenger traffic. The Prime Minister said he learned about the matter a day after the ship had anchored south of Port Royal, and by then it had already left. However, in a joint statement, the National Security and Foreign Affairs Ministries said they surmised the captain left because he could not be guaranteed landing. Lockdown chaos as St. Catherine residents flock streets for supplies. From as early as 7 a.m. today, scores of residents in the parish of St. Catherine, which has been under lockdown since Wednesday, took to the streets to buy supplies during the allotted hours, causing chaos at some locations. St. Catherine was placed on a 7-day lockdown by the government after a spike in the number of COVID-19 positive tests, mainly associated with the Alorica Business Process outsourcing entity in the parish. Food outlets in the areas of Portmore and Spanish Town is the place mainly being impacted by the surge of shoppers who are seeking to stock up on supplies. One Portmore resident who gave her name as Lisa said, "I am now at the Independence City Plaza. It is unbelievable. Coming out here this morning to conduct my business, it is just unbelievable. The food stores and pharmacy have long lines. Me no know how long me can keep this up. God have to help me with this one." Another shopper in Portmore said that she was not expecting the crowd that greeted her. "Me come out from as early as 6 a.m. with me tea because I knew it was going to be difficult. But Lord man, me never expect this. Rosetta said. "This a madness. The place them pack up. We need help." According to another woman in Portmore who gave her name as Jean, she's holding out despite the crowd. "Me reach the plaza about 6:30 this morning. And when we get there, lines were all over the place. This is really difficult. And I'm worrying a lot. A lot of people don't understand how difficult it is. But I have to get some things to my family, so I'll have to tough it out," she said. Manchester BPO facility ordered closed by Health Department. The Manchester Health Department has ordered a business process outsourcing BPO facility in the parish to cease and desist operations following an inspection of the call centre. Concerns have been raised about the operations at BPO facilities across the island after several employees of Alarica and Portmore St. Catherine tested positive for COVID-19. In a statement released yesterday, April 17, Medical Officer of Health Dr. Nadine Williams disclosed that the Manchester Health Department inspected 3 BPOs in the parish. "We have since yesterday been informed of another facility that is operating in the parish, and based on the conditions, we'll have to cease and desist operations," the statement read. Checks revealed that the BPO facility is located on Villa Road in Mandeville. There are 2 known BPOs in Manchester, Sutherland Global on Ward Avenue and Kingsland District. Both were inspected in March and again on the 15th and the 16th of April. They have implemented the necessary measures to reduce exposure and so will have passed the inspection, she said. Dr. Williams said the entrances have a sign-in area which is marked to ensure physical distancing, and there's a dispenser of hand sanitizer at the entrance. They have increased the number of employees working from home, increased the space between workers. People are screened prior to entering the facility with temperature checks and questions related to any health issues. If there are concerns, then they are referred for medical attention. The stations have alcohol that can be used to clean the items in the stations. Quarantine in Cornpeace settlement lifted. The Ministry of Health and Wellness is reporting that the quarantine imposed on the Cornpeace settlement in Clarendon has been lifted. The ministry said the quarantine was lifted because the community is no longer deemed a public health risk. The community was put under quarantine for an initial 14 days on March 19, following the first confirmed COVID-19 death in the area. The quarantine was then extended for a further 2 weeks on Friday, April 3, after 6 close contacts of the deceased tested positive for the virus. The ministry said, however, that public health authorities will continue to monitor residents. Fleeing lockdown families caught out west. More than a dozen family members who fled Portmore to avoid a COVID-19 lockdown of St. Catherine and sought refuge in Hanover and St. James are now being quarantined in state facilities in western Jamaica. Special teams from the Ministry of Health and Wellness and the Area 1 Police rounded them up between Wednesday afternoon and Thursday morning and placed them in protective custody. According to reports, residents of Jarrett Terrace, Montego Bay, and Sandy Bay, and Montpelier in Hanover contacted their local health department after they noticed several family members moving into their neighborhood in the aftermath of the announcement by Prime Minister Andrew Holness that St. Catherine will be placed on a lockdown to blunt the spread of the new coronavirus. The medical officers of health in both parishes solicited the support of the police and visited the 2 locations in operations mounted over the past 2 days. A number of persons from St. Catherine addresses were identified and picked up. On Jarrett Terrace, a 40-year-old woman, a 38-year-old male store manager, 2 children aged 8 and 13, all from Lime Tree Grove in St. Catherine, were taken into state custody alongside a 62-year-old homeowner and transported to a quarantine center at Rose Hall on the outskirts of Montego Bay. Over in the Sandy Bay, Montpelier area, a woman from St. Catherine and other members of her household were picked up and taken to a quarantine center in the Hanover Parish capital, Lucy. Dr. Marcia Johnson-Campbell, Chief Medical Officer for St. James, confirmed that persons were picked up in the parish, tested, and placed under quarantine. I can acknowledge that we have been getting a lot of calls of persons moving into the parish from St. Catherine after the lockdown was announced by the Prime Minister, Johnson-Campbell said. Dr. Kaushal Singh, medical officer for Hanover, said that his team, which was still in the field late yesterday afternoon, also received reports about persons moving into the parish from St. Catherine. Our team went to the community. where it would have tested a female and other members of a household for symptoms of the COVID-19, Singh said. So far, we have no reason to believe that these persons have been infected, but based on the protocols of the Health Ministry, the individuals were placed under home quarantine. Why Jamaica reject Cuban COVID-19 drug? Chief Medical Officer, CMO, Dr. Jacqueline Bisesa McKenzie, has said that the government's decision to reject the use of the Cuban antiviral drug interferon alpha-2b to treat persons battling COVID-19 at this time was made after consultations with experts in the public health sector. She told the Special Select Committee on Public Health discussing developments in relation to the coronavirus pandemic yesterday that the side effects profile of the drug, as demonstrated in trials with other diseases, included fever, diarrhea, depression, and deaths. The CMO was responding to questions as committee members met via an online platform as part of efforts to observe physical distancing protocols in the wake of COVID-19. A clinical working group comprising pulmonologists, anesthesiologists, pediatricians, critical care specialists, emergency room physicians, pharmacists, standards and regulations personnel, among others, reportedly reviewed available material on interferon alpha-2b and decided against its use. Further, Bisesa McKenzie said that there was insufficient evidence to support the unreserved use of the drug at this time. She said that the administration of the drug requires nebulization, which is aerosol generating and therefore not recommended for patients suspected of or confirmed for COVID-19. Based on these, I think that they did take a lot of time to consider it, and based on the information that is available at this time, they have made this recommendation that I support, the CMOs added. Speaking in Parliament on Wednesday, Health and Wellness Minister Dr. Christopher Tufton said that the ministry had completed its assessment of the antiviral drug, and given that it had not been approved globally, the decision was made not to use it in Jamaica at this time. It's not that we have not looked at it. As you know, we have been collaborating with the Cuban government in several ways, and we are very appreciative in terms of the clinical capacity that has been added to our frontline against COVID, Tufton said on Wednesday. The antiviral drug is one of several being used by the Chinese to fight the new coronavirus and is reportedly proven effective for viruses with characteristics similar to those of COVID-19. JBN, we keep you informed. Please remember to subscribe, like, share, leave us a comment, and click the notification bell to receive our daily news items.